So today we have Bob as our patient. Bob is in orthodontic treatment. He is complaining of some sensitivity when brushing his teeth and puffy gums. So today we're just going to kind of go over little things that we can do to help Bob have a better oral health with braces. So Bob, I see that you have some puffy gums here. I'm just going to show you with braces how to brush your teeth. So we have an orthodontic toothbrush here, and this brush has smaller bristles inside the brush to help get under the brackets in every direction. So when you brush your teeth with braces, we're going to use the Charters method, and we're going to go above the bracket and we're going to brush on the gum line, and we're going to go underneath and we're going to brush like that. And all around, you want to make sure you're pushing out the food and bacteria out of underneath the braces, and do the same thing under here. When you're brushing the lower teeth on the inside that don't have braces, go on a 45-degree angle, and you want to make a mess of your mirror. So you want to brush and push off any of the bacteria very gently. Cleaning the inside of our teeth and going in circles all around the other teeth. Again, going 45-degree angle so that we get our bristles in between the wire and the teeth. And we're going to do this in every direction. Here. I'm also going to have you use a mouth rinse, a fluoride mouth rinse. Act is really good. Any flavor is fine. It's up to you. And also some Super Floss. I like Super Floss a lot because it goes up the bracket like this, and we can really floss the teeth. Going all the way around through each tooth. So you just have to pull it through and floss each tooth all around. This should help with getting all the bacteria out of in between your teeth, the biofilm we call it, and it can help you get on better track and be healthier, and get that swelling down so that your gums look good. And when the braces come off, everything is nice and clean. You have no cavities because you've been brushing the way that we've taught you, and that's pretty much it. So morning and night, we're gonna brush just the way I showed you. Again, Charters method is 45 degrees above the bracket, along the gum line, and then under the bracket, getting all that food out. Okay. So Bob, I'd like you to come in 4 months so I can just make sure that we're doing a really good job with brushing at home. And then we can see kind of how to go from there with you. And we'll make sure that your gums are on a better track and you're comfortable, you're not sensitive, you're not having any more swelling on your gum tissue or any bleeding when you're brushing. This method of brushing and the flossing method is really good. They sell Super Floss at any Rite Aid, Walgreens, any store that you go to, drugstore. And when you use your toothpaste, I want you to use just a little bit. So I'm going to show you, I have here Colgate Total, and it's good for cavities. It has fluoride, which is really good. I recommend for the teeth, especially with braces on. So just a little bit of toothpaste on the toothbrush, and that little purple part is all you need. So just a right size amount, a little water, and brush above the bracket, all above the bracket. It's a nice circle motions getting underneath here. And then like this. very gently. You want to be using an extra soft toothbrush to make sure that we're not taking off any gum tissue. We're not hurting the gums. We want to use an extra soft toothbrush. And when we do the insides, 45-degree angle so that we can get the back of the teeth as well. And when we do the front, we're gonna swoop, circle, circle, swoop, circle, circle, swoop, circle, circle, swoop, circle, circle, swoop. And that's gonna clean the back of the teeth. And again, I like to remember it as getting your mirror dirty. Same thing here, above and on the tooth surface. And when we get here, circle, circle, swoop, circle, circle, swoop, circle, circle, swoop, circle, circle, swoop. And we're gonna brush above and again below the gum line, making sure that we're getting rid of any inflammation, any bacteria that's on our teeth. And that's how to brush with braces. So I'll see you in 4 months and we will see how you're looking.